Welcome to week 3 of Candidate Voices with 5051 Savannah, the series that brings you 5-minute interviews with candidates from Georgia's 1st Congressional District, U.S. House election 2026. We welcome any candidates running for this office who meet our mission of upholding the Constitution and ending executive overreach to join us. Each of our candidates receives the same question in advance. Today we have Randy Zurcher with us. Welcome, Randy. Here's the question. Rural parts of the 1st District face growing healthcare deserts, especially for mental health and maternal care. What federal policies would you support to improve rural healthcare access and prevent further hospital closures in this region?
Thanks again for this opportunity to speak to y'all. I really appreciate it. My mother was a registered nurse for her whole career, and she did just about every kind of nursing from psychiatric care to accident to hospice. She even did home health and prenatal. So healthcare is and always has been close to my heart, and I believe that healthcare is a human right. Um, Now, the growing healthcare deserts in rural parts of our district, it's a very real problem, and it could get much worse if this budget bill goes into effect. So keep that in mind. To improve the healthcare access and hospital closures, there are several federal policies that I would support. First of all, we need to fully fund and expand Medicaid in Georgia. With that one move, we could bring billions of dollars in federal funds to Georgia, stabilizing rural hospitals that serve large numbers of uninsured and underinsured patients. It would expand access to preventative and primary care, ease pressure on emergency rooms, improve long-term health outcomes, create jobs, and strengthen rural healthcare infrastructure. So just that one move alone, if we could just fully fund and expand Medicaid, that help tremendously. But there are other things we do. Another thing would be to boost incentives for rural healthcare providers. So tackle the workforce shortages. We could expand federal incentives like scholarships, loan forgiveness, and bonuses for health professionals that are willing to work in the health professional shortage areas. Excuse me. Of course, more attention would need to go to mental health and prenatal care, since those seem to be the most needed services in underserved communities. Another thing we could do is invest in rural clinics and community health centers. So rural healthcare clinics and federally qualified health centers are lifelines in underserved areas. Increased funding would allow them to open longer, to expand care options like dental, urgent care, substance use treatment, and they could hire more staff, which would ensure local rural patients can receive essential care close to home. If you have to travel 50 to 100 miles just to see a doctor, there's a problem, and there are a lot of people that will die because of that. So it's very important. Another thing we can do, though, speaking of travel, is expand broadband, because that'll support telehealth. Reliable internet is essential for modern healthcare, especially in rural areas. Broadband expansion would improve access to telehealth for mental health and prenatal care, like we talked about before, reduce travel burdens, and connect patients with specialists. It's really critical in closing the rural healthcare gaps. So I believe that broadband, yes, it should be considered an infrastructure issue. It's also a big health issue, especially for our rural areas. Another thing we could do is establish a rural hospital stabilization fund. So to stop the closures, we need a dedicated federal fund that would provide financial support for struggling facilities. So it would maintain vital services and help hospitals transition to sustainable models like emergency departments, birthing centers, and outpatient hubs. And that would ensure that care continues even as needs and budgets change. So I guess just summing it up, in the face of growing healthcare deserts across our first congressional district. We can no longer afford to ignore the systemic failures that are putting lives at risk. From expanding Medicaid and investing in rural health infrastructure to recruiting providers and strengthening telehealth access. The path forward is clear and it requires federal leadership. With the right policies and targeted investments, we can stop the closure of rural hospitals, rebuild our healthcare workforce, and ensure that every Georgian, no matter the zip code, can have access to the care that they need and that they deserve. That's what I have for you today. Thanks so much for having me here.
Thank you so much,
Randy.
Randy.
Oh, I was just going to tell them randy4georgia.com.
All right, we'll see you next week. Thanks so much for
Thank,
joining us.
thanks, Robin.